Hello, this is Lynn George again. The topic for this week is planning to teach. Planning to teach can seem to be a daunting task. And as the Cheshire Cat from Alice in Wonderland reminds us, if you don't know where you're going, any road will get you there. As educators, we must know where we are going in order to plan effectively. That is why most educational design experts recommend that you start where you want to be with your planning efforts, and in a sense, work backwards. What do you want your learners to learn? What outcomes do you want to have from the lesson you deliver? This may be knowledge or competency, or another way of saying this is what are the knowledge, skills, and attitudes that you want your learners to acquire. Knowledge, skills, and attitude cover the cognitive, psychomotor, and affective domains. This week we will focus on these objectives as you begin your projects and develop your teaching or lesson plans. For the topics that you are thinking about teaching, you must determine what is the essential curriculum for your particular group of learners. In other words, what should your learners know at the end of the lesson? So you need to identify the essential content. For you as nurse educators, this often means what is best practice. This may be the standards from a professional organization. Say, for example, the American Heart Association if you're teaching a CPR course, or the research evidence about a new way of practice. So if you plan backwards, you need to know what the targeted essential content is. And that means exploring the research and theory about your topic. For as you well know, knowledge about healthcare is ever-changing. The objectives for this week also mean that we should make educational decisions based on educational best practice, and in this case, evidence-based educational practice. So evidence provides the guidance for your content choices about practice, but also the teaching learning choices. Planning to teach is a complex process, and the bigger the scope of the intended project, the longer it will take. So for your projects for this course, remember, less is more. Work with your preceptor to determine a lesson or portion of a lesson that you can manage. If possible, select a topic that you already have clinical expertise about, so you can focus on the process. You will need to develop a lesson plan. You learned about lesson plans in your curriculum development and assessment course this past summer. So in the rough draft of your lesson plan for this week, identify the following with a focus on the first three. We'll spend more time on the fourth one later. What are you teaching? Who are the learners? How will you teach? And how will you evaluate the learners in the process? And remember, the fourth one we'll spend some more time on later. For the what, you need to focus on that essential content. Your preceptor should be able to give you some guidance about this, and it will be individualized based on your particular placement and the activities available to you with your preceptor. What are the standards, essential content based upon the standards, and how your lesson will fit into the big picture? You are stepping into an existing educational setting and participating in just one piece of a larger whole. So find out where your lesson fits. Objectives for the big picture most certainly exist, so find out what they are. Objectives may exist for the section that you have selected. If so, you will need to use those behavioral objectives as part of the framework. But I also want you to write objectives linked to those that exist for your particular portion of the project. For example, in this course that you are taking, there are program objectives or goals. The course objectives are linked to those program objectives or goals, and then weekly objectives are linked to the course objectives. You need to make sure that your lesson links like this, and write 1 to 2 objectives for your particular lesson. The graphic in this slide demonstrates the broad to specific writing of goals and objectives. For the who, You need to identify who your learners are. You might think of this as a demographic assessment. This photo demonstrates the challenges that many nurse educators face. The learners are typically diverse. But for this first step, you need to know how many learners will be part of your lesson. Perhaps what their ages are, their level of learning. Are they in an academic setting and a freshman through sophomore? Are you in a clinical practice setting or a community setting with different levels of learners? What's their experience, etc. Next week, we will focus more on this important topic and explore assessment of the needs of the learner more in depth. But for this week, describe them in your lesson plan. This is information you can get from your preceptor or gather for yourself as appropriate. As new educators, and sometimes as experienced educators, we often use the how to teach that we know. Maybe how we were taught, for example. But you have been participating in a new world of online education, and that may have been a new how to teach for you as a student. The how decision is a complex one, of course, and today there are many options available to you. It involves considerations that are informed by the content, the learner, the situation, and other factors, including your own expertise with certain ways of teaching. In your lesson plan, you will need to identify the how, what strategies and format you think are appropriate, and why you want to use them. The purpose of this cartoon is to encourage you to think differently about your lesson. What other choices do you have? What does the evidence support as best practice for education? Your textbook provides you with important details about the how selection process, and you need to delve deeper into this process by reading about what your authors have to say. So creating your lesson and making choices about appropriate strategies requires that you think about some of the following. The desired learning outcomes, knowledge, skills, and attitudes, for example. The learners and the learner characteristics. Are they experienced, not experienced, adult learners versus traditional learners, etc. The learning and work environment. Is this learning taking place in an academic environment, or is it taking place in an on-the-job training? So on-the-job training versus academic preparation for the profession. You're going to plan the how differently based on that. What constraints exist? Time is always a constraint, and we don't have unlimited time to deliver the content. What resources are available to you? This can be a constraint. Certainly, if you plan to deliver your lesson in an online format and there was no learning management system available to you, that wouldn't be a choice, that would be an option. There are certainly other constraints that need to be considered. And it is always an it depends answers based on the understanding of these different parameters or ideas that you need to consider. So, the key points from this presentation are for you to make a rough draft of your own lesson plan this week that includes the what, who, and how.